Welcome, Starchivores from all over the world and all over the United States. We are here with another exciting webinar, live with Dr. McDougall. And today, most of the webinar is dedicated to a very popular topic, which is anxiety and panic attacks. And the brilliant psychologist that we have is Dr. Doug Lisle, PhD, and he is going to talk to us about this topic. And I want you all to go ahead and type some questions or email the questions, because in the following webinar that we will do with him, we will address more questions. The address for email is webinar@drmcdougall.com. But today I had to have Dr. McDougall also as a guest at the beginning of this webinar, because he has some very interesting and very important news about, well, I will let him say that. And I want to welcome you, Dr. McDougall, from Santa Rosa, California. How are you?
Well, thanks for the opportunity. I'm glad that Doug Lisle is going to give me a little bit of time. I don't have it at hand, but last week and the week before, I talked about an article from the American Journal of Clinical Nutrition showing that where they fed sugar and starch to people to improve their depression, anxiety, all kinds of behavioral issues. So tying in with Dr. Lisle's talk, whether he discusses it or not, I want to add the very important comment that what you eat makes a huge difference in how you feel. It relieves depression, anxiety, makes you a much more satisfied and confident person. Your body's not always going around and looking for food. So if you want to after this presentation go back and look at last week's and the week before's, it gives you a reference to the American Journal of Clinical Nutrition discussing all this on how carbohydrate benefits your psychological well-being, and you can find many other articles to that effect. The excuse that I got for coming on the show, but kind of busting my way in, was an article published just a couple weeks ago. It actually hit the headline news, and we sent you a copy with the invitation of a representation of it from the New Scientist. But the actual article is in Chemical Sense Advanced Access publication of August 23rd, 2016. So let me say that again. Chemical Senses Advance. So that name of the journal must be Chemical Senses. Well, they talked about how in this paper, which you cannot get unless you have library access, about how they've discovered a new taste, which is a taste for starch. In addition to sweet and salty, which are the two tip taste buds which cause you to seek salt and sugar, there are two taste buds on the back of your tongue that cause you to avoid things. They are bitter and sour. Bitter and sour things in nature are poisonous or at best medicinal. Salt taste buds cause you to seek minerals, which is good. You need that. And they suggest in this paper that there may even be an independent taste bud for calcium. Now, that will be interesting to see. They discovered something else in this particular paper that causes me to be happy, rejoice, I guess, that they've discovered that there's an independent taste bud for starch. And so when they blocked the sweet tasting taste buds, and we all thought, including myself, we all thought that it was the sweet tasting taste bud that drove us to these starchy foods like bread and rice and corn and potatoes. Well, that drives us for sweet stuff such as fruit, I'm sure, no doubt. And as these starches break down in the mouth into very simple sugars, and they do to some extent with amylase, those taste buds are probably activated. But when they blocked these sweet tasting taste buds, completely blocked them, what they found is that there was an independent taste bud for starchiness. There was an extremely positive taste bud, and it is stimulated with equal molecules of starch compared to the stimulation that occurs with the sweet tasting taste bud for sweet. So it's a very powerful taste bud, which makes all the sense in the world that we would be designed with a taste bud for starch, because we're starch eaters, starchivores, starchitarians. They talk about also a taste bud for fat being discovered. Well, that was discovered several years ago, and if you go to my website and look up taste bud for fat, you'll likely find the the article that I wrote, it's a taste bud of aversion, not attraction. When people can taste fat, they avert it. Obese people can't taste fat, but trim people, naturally trim people can, and it's repulsive. We declare victory by the discovery of the starch taste bud. At least is our week to shine, to prove to people that that's what we're supposed to eat. Important article to get in your foundation of understanding so that you can resist all those people who say you must have your dairy, you must have your meat. Say, look, I have no taste buds for dairy. In fact, the only way they can get me to eat dairy is to put sugar in it and sell it to me as ice cream, or put salt in it and sell it to me as cheese. Otherwise, I can't eat it. You know, the only reason you can drink cow's milk itself is it's 30% sugar designed for that calf. But otherwise, you couldn't stomach white cow's milk. I mean, I couldn't when I was a kid. I had to buy chocolate milk. Even though when I was a little kid, and I came from a quite financially poor family. On morning break, when I was 5, 6, 7 years old, we had at morning break, we had a time when we could either have tomato juice with no salt, disgusting, or we could have white milk, which I couldn't get down, or we could buy chocolate milk. Well, white milk was 2 cents, and chocolate milk was 3 cents. And I have to tell you, I felt guilt about spending that extra penny. But I couldn't get the unadulterated stuff down. It's so disgusting. So that's more than 70 years ago.
Can everybody see that picture?
It says save bread, save potato, serve potatoes. And let's see. Does that one show the whole?
Yes.
Let's go on to the next one also.
It shows.
And you save lives. Save bread and you save lives. Save potatoes and you
serve. It's a serve the country. Yeah.
There you go. A World War II poster telling people to save lives and serve your country. You serve potatoes. That's
right.
Pretty cool.
And the other one that you have that you sent me to show is wait a minute. I think that's
I see it. Potatoes, feed them without fattening and give you energy, but it's only part way, part of the picture.
Right. Let's see. Let me do it one more time.
I will say Rachel sent that to me. Rachel sent that to me via email. There are so many valuable things that you folks run across, and I'm sure I got the original starchy taste buds from one of my email people too. All right, so this is another World War II poster. Potatoes, feed without fattening and give you energy. That's 70 plus years ago, ladies and gentlemen. Current science, past history. Now I'm going to tell you one other thing. Are you ready?
We are. This is very exciting.
5 copies.
Oh, there it is.
And we'll
can't wait to read it.
We'll have it at the Advanced Study Weekend, which is next weekend.
Right.
16th through 18th. We still have room for folks. We have a really good turnout to see Dean Ornish and all the young doctors, Craig McDougall, Matt Letterman, Alona Paldi, Tom Campbell, and Anthony Lim. To see all the young doctors. And then T. Colin Campbell will be there with me and a few other doctors that you don't know about to do a nice discussion with them. We have Brenda Davis. We have John Mandrola to talk about heart disease and diet and atrial fibrillation. Well, it was really tough to get that guy here, I want to tell you. But we did get him here. We have Mike Osner. Osner's his name. Michael Osner, MD, diet and lifestyle, metabolic health. He'll be talking about the Mediterranean diet. And believe me, it's not going to be without my comment. So if you want to see my comments at the end of this presentation, show up. They'll probably be fairly positive, but I'm going to ask him some tough questions as I do all of our guests. And Brenda Davis, that's in the morning on Saturday, and then we're going to have the new generation of doctors on Saturday afternoon. Then Nelson Campbell, Plant Pure Nation, the guy who developed the video Plant Pure Nation. He'll be talking. Susan Roberts from, oh boy, she's an expert on nutrition and health from one of the big universities in Louisiana. Anyway, she will be there. I'm going to become much more familiar with our guests, believe me, before time comes. And then Dean Ornish is going to be there at 11:30. I'm going to give 2 talks, and you might enjoy the titles of the 2 new talks, because I just had Heather add them. The first talk that I'm going to give on Friday night is called Fired. You know, kind of after Donald Trump's show Fired. I'm going to talk about how I was fired from the Obesity Medicine Conference and also from the World Vegan Conference. I was fired from both, and how you know, I just can't make everybody happy. So I'm going to talk about that Friday night, and then the two presentations that I give on Sunday. The first one is called "Do Not Cath, I Will Sue," and it'll be talking about how the heart disease business is basically lying and cheating you, and it's based on a newsletter I did a few months ago, where I showed you my naked chest. Do not cath, I will sue. I'll be talking about that. And then from a couple months ago, I did an update on colonoscopy and how the Canadian Medical Association, Canadian Medical Preventative Services Task Force, and the U.S. Preventative Services Task Force have taken a very dim view on colonoscopy. And so the title of this talk, are you ready, ladies and gentlemen? You may ask me to change the title. But I think it's right. It's called Up the Wrong Butt Colonoscopy.
Okay.
Up the wrong butt. Anyway, you know me. I can. So I'm going to be giving 3 lectures this time instead of 2. That's going to be very interesting. Good. And I'm going to be very much involved with all the speakers. So hey, you got a week to sign up. We got direct flights into Santa Rosa. We got fairly convenient access from Oakland and San Francisco Airport, and we'd really like to see you there. You want to change your life? You want to get a little motivation? You want to meet Gustavo?
Yes, of course. Of course you want to meet me.
You want to meet Dean Ornish, and he gives rare performances. You want to meet some of the best experts in the world, and this will be never repeated. I never do the same advanced study weekend again. One in February next year will be completely different. So you don't want to miss this. You're going to say to yourself, why did I not go? Or secondarily, you can watch it on a few minute delay, almost live by the internet. And you can sign that up on the internet broadcast, which is on my website. Just go under programs and advanced study weekend, and there's a link to sign up both. Come and see us in Santa Rosa, California. Be well worth your trouble. Mary will be there. Heather will be there. My son Craig will be there. It'll be just a great time. Come see us live. That'll be next weekend on the 16th of September beginning, or sign up for the internet broadcast. And it's almost live. It's good, but you don't get to taste the lasagna.
Oh, you don't.
You don't get to taste the pink burritos. All the phenomenal people. Oh, I want to go back to the book. I'm sorry. I just didn't do enough. Okay, so here's the book. Now, those of you who wondered about the book, I'm just going to take a minute here and tell you, if I've got time. Yeah, I got just a couple of minutes. The first chapter is There Are Lies and Damned Lies. And damned lies destroy the planet and its people. So it talks about the liars. The second chapter is my story, which many of you know. And the third chapter is the healthiest diet versus fad diets. And fad diets like paleo, like grain brain, wheat belly, a direct attack on these people, direct attack. And then the centerpiece in beautiful color is Dr. McDougall's color picture book. Starts right here. And you can, of course, get all this free on the website. I understand that. But it goes through, I mean, if you've got a friend, okay, that you want to convert. Look, this is from the color picture book on the internet on my website, free. You can't get them to watch that. So you take this book and you go up to them and you say, look, I know you've only got 10 minutes. Turn to the centerpiece, and it'll take you 10 minutes to go through Dr. McDougall's color picture book, which is full of beautiful pictures, you know, all kinds of the, you know, the do not eat things that we talk about, so people can really quickly get it. And then it goes through the things that you're supposed to eat, all the beautiful recipes. And then Mary got a section. This is the first time she's been able to do this in all the books, all the 12 books, national best-selling books we've been able to publish. For the first time, she's been able to have color pictures of her recipes in the book. So not only will people, the novices or those who are familiar, be able to get the message, they'll be able to get it in beautiful color, and taking a few minutes at all to take and look at it. Oh man, that pasta looks, I would love to eat that for lunch or dinner. And very well put together recipe. Mary's favorite, actually. She even got pea soup in there, which we had to do at a last minute deal. So
beautiful,
this is
beautiful
the book
picture
for people who don't want to read, or some people just don't have that communication skill or patience or time. So you say, okay, here it is. It'll take you, spend 15 minutes on it to get rid of your type 2 diabetes, to stop the constipation, to lose 100 pounds, slow the breast or prostate cancer. It'll take you 20 minutes. 20 minutes. It's a beautiful book. That's why I agreed to do this. This is a beautiful book, and I have to tell you, its price, I think it's $27 if you buy it retail, $27.99. But if you go to some of the websites, internet websites like Amazon, it's like 16 bucks.
Right.
We're not even going to sell it from our website. We're going to sell it at the Advanced Study Weekend. We'll have it next weekend for you, and Mary and I will be happy to sign a copy. But that's the deal. I suppose I'm out of time. We're going to get on that.
We're out of time.
You have a good time with Dr. Doug Lisle, and thanks for bringing me in for a few minutes, Gustavo.
It's always our pleasure to see you, Dr. McDougall, and I look forward to seeing you next Thursday. We're going to do another webinar, and then I'll see you in person the following day.
Okay, well, I look forward to it, especially the weekend.
Very good. All right.
Folks, thank you. Bye-bye.
Okay, everyone, here we go. We're starting with Dr. Lisle. Just give us a few seconds, and we'll get started. Welcome, everybody, and here we are in another live with Dr. McDougall webinar. Only that this week we have as a guest Dr. Doug Lisle, and he has been with us many times, so I don't have to give you a long introduction. It is always a pleasure to have him here and an honor. Just so that you know, if you're new here, Dr. Doug Lisle is a psychologist for the McDougall Wellness Program and the Director of Research for True North Health Center. And he has written the book, The Pleasure Trap. And he also has a wonderful website called Esteem Dynamics, which you will see in your screen in just a minute. And you can contact him and set up an appointment to talk to him on the phone or Skype. And the email is also going to appear in just a few seconds on the screen. It's drdouglisle@yahoo.com. So we are very excited to have you, Dr. Lisle, here today and talk about a very important topic. How are you doing today?
Good. Great to see you, Gustavo, always.
It's always fun to see you, even though we're miles apart with the magic of the technologies, like we're sitting in the same room.
Yes, absolutely.
Well, this is a topic that a lot of people have requested at one point or another, and it is the topic of anxiety and panic attacks, which actually I would like, if you don't mind, starting with a question, the general question as, are these two conditions, I don't know what to call them, the same thing? And if not, what is the difference between anxiety and then panic attacks?
Well, you should think of it as a continuum, whereas anxiety is kind of like being, you could say that would be the equivalent of a little bit of a bad mood or a little down mood, and then major clinical depression would be like a panic attack. In other words, it's a matter of degree. So all of us are having little bits of anxiety all the time, including you and I with the technical glitches that we've had. So in other words, that's normal. And but then the issue is that you can get increasing escalated anxiety depending upon what seems to be at stake for the person, and they get greater and greater physiological responses, and then all the way to the most acute form of anxiety, which would be a panic attack. So a panic attack is sort of the culmination of what's possible in the nervous system, and it's really designed for, as we'll see, it's designed really to be a process of defending the person against life and death circumstances. So you would expect to see panic attacks happen when people's lives are literally at stake, and you often will.
So would you explain, I don't know, just to give all of us an idea of how this is developed, and
Sure.
anything you want to talk to us about.
Absolutely. We'll just explain this in the next few minutes.
All right.
What's happening is the following. Let me explain what a panic attack feels like, and then we'll go from there. So panic attacks generally have a whole host of things that happen. So when people have panic attacks, they will usually feel their heart pounding. They will usually sweat. They will usually feel like they want to escape or flee. But they also, interestingly enough, feel frozen, like they can't move. Sometimes they'll feel nauseous. Sometimes they will feel like, once in a while, sometimes people will feel like they want to pee or poop. That will sometimes happen. And so this is sort of the, also they'll have a shortness of breath. They'll feel like they can't breathe, like they're choking. So this is an amazing set of symptoms, and it will appear to people like this is some terrible thing, and it will feel terrible. But once we put it in perspective and we see what it is, our perspective can start to shift, and it can tell us what we can do about it. So let me tell people where panic attacks come from, and incidentally, and then it'll become apparent also why panic attacks happen they get chained. In other words, once you've had one, then you're very likely to have a second one. Once you've had two, you're very likely to have a third. So once a pattern gets set up, people can have panic attacks and might last their whole lifetime. Sometimes people will have only one panic attack their whole life, but they're a little edgy, from that point on. Most people will never have one, but the people that have them will oftentimes have them for quite a while, and as I said, sometimes indefinitely. Now, here's what's going on. That if we look at these reactions, well, first of all, if we look at anxiety in general, what anxiety is the warning device to tell you to avoid something. That's what it is. So whether it's your mother-in-law or the guy that's just cutting you off on the freeway, whatever it is that the little trepidation that you feel is a little anxiety that you feel. That's a warning device to tell you, oops, try to avoid this problem. So we can expect that the ultimate of all anxiety, being a panic attack, should be something about avoiding something major. And it's going to turn out that if we look back to our ancestral history, we're going to find what that major thing is pretty quickly. So I want you to take yourself back in time. All human beings, 100,000 years ago or so, were in Africa. And so very much of your body was built in Africa. It was built for the problems of Africa. And obviously we've had skin tone differences that have changed since people migrated out of Africa into different parts of the world. But the fundamental chassis of the human body and the human mind were built there. And so if we go back there, we're going to start to understand what a panic attack is. So think about yourself walking back to the village with 4 or 5 of your friends, and you decide to take a little detour for a second and go down to a little creek, and you're going to have a little drink of water. And so there's some high grass there, and you kind of gently push back the grass, and you're a little bit careful because you don't want a crocodile to come up and eat you. So you're kind of looking at the water, and it looks like it's fine. And then you look across the creek, and about 50 yards down the creek, you see an African lion. Now, what you're going to do is going to be interesting at this point. So let's walk through this, because this is in the anatomy of a panic attack. The first thing you're going to do is you're going to freeze. You are going to not move. And the reason is you don't want to catch the attention by your movement of that predator. So there's going to be a tremendous sense of instant freeze. And we've all seen this, for example, in rabbits. Rabbits will take one look at you, and then they will absolutely freeze. They'll not move a muscle, and hoping that you haven't seen them. So this is a standard prey behavior, and that's what will happen with people. They'll freeze. If you're starting to walk down an alley in San Francisco to cut the block off so that you don't have to walk around the block to get your car, and you hear the tin can rattle down the thing, you will instantly freeze. Okay, so this is a normal reaction. So what's going to happen next is you will start to sweat. And the reason you're going to sweat is you are about to run for your life. And so when you start running for your life, you're going to generate the maximum amount of heat that you can generate. And that heat will actually wear you out and make you less efficient. So therefore, what your body is doing is it's going to start sweating now so that when you start to run, it will cool you off. So this is giving you a head start on the biological stress that you're about to face. The other thing that you're going to do is you're not going to hardly breathe. You're going to feel like you're choking and you can't hardly make a sound. The reason why this is going to be true is that by constricting your breathing, this is a mechanical method for raising your blood pressure. You'll see this in Olympic weightlifters. You'll see them hold their breath. And as you hold your breath, what happens is that it raises the blood pressure and allows the cardiovascular system to push blood away from your viscera into the big muscles of your legs and in your arms and your chest. So what's happening is when you're shortening your breath, it isn't that you can't breathe. Nobody with a panic attack ever suffocates. Okay, what happens though is that shortness of breath is driving oxygen into the big muscles of your legs because you're about to run for your life. Now, the next thing that we're going to see is inside the person's head, they have a tremendous desire to flee, obviously. We now know why, okay? They don't know why they want to run from their mother-in-law. They just do. Okay, so they've got a desire to flee this situation. However, they also feel frozen. So they've got two gigantic motivational systems that are clashing inside their head, and they're balancing each other on a knife's edge. So at the one hand, they want to run for their life, and on the other hand, they can't move. This is exactly the situation that you should be in if there's a predator 50 yards down on the other side of a little creek. In other words, you should be completely focused and poised on that predator, and as soon as it turns its attention to you and starts to move towards you, you should run for your life. So you are ready at a moment's notice to actually completely change survival strategy and to do everything you can possibly do to escape the predator. That means, for example, that you are no longer going to be digesting any food. As soon as you see that predator and begin to have this experience, all digestion will instantly stop. The reason is that there's no point. The food is there for longer term issues. It's for later on this afternoon. What you're burning up now is the blood, the sugar that's in your blood now, and the glycogen that's in your liver now. You don't need to digest this food for anything. So all digestion stops. The blood starts moving away from the digestive system into the muscles. The breath is now short in order to push the blood into those big muscles. The heart is also pounding. So people can feel their heart pounding, and it feels to them like they may be having a heart attack. But actually what's happening is normally the heart is at about a 20% resting rate when you're just walking around doing not much of anything. Whereas when you're in the beginnings of a panic attack, that heart rate will go up to 40%. So in other words, the heart rate doubles. So people that are having a panic attack, they think that they're going to die from this, or that their heart's going to burst or something. They can't breathe. It just feels like it's some disaster. It's not even close to a disaster. Your heart isn't anywhere near its capacity. What it's doing is it's getting a running start. Okay, so just like your sweat is getting you a running start on cooling you down, and just like the constricted breathing is getting you ready to run before you start to run, so does the heart also start pounding as it raises the heart's capacity, raises its efficiency up to 40% instead of 100, as it's essentially like if you were in the Olympic Games and you were going to run a 100-yard dash. If you got a running start where you got to run at 40% of your maximum speed before you then hit the tape and started the race, these sprinters, that guy that had that advantage would win every time. And that is exactly what the heart is doing to help you get essentially a running start on this cardiopulmonary problem. Your job is going to be to grab as much oxygen as you can and to push as much blood as you possibly can to those muscles so that they can work at their maximum capacity for as long as they possibly can, because that could be the difference between life and death. So now when we come back and we look at what a panic attack is, a panic attack actually isn't an attack. It's a adaptation. It's an adaptive mechanism. This is your friend, for goodness sakes. And it's there to actually help you deal with a life or death predator-prey situation. Lions don't have panic attacks, as you can imagine. They don't have a predator they have to worry about, so they don't have this situation. We have that situation because very often people were prey. And actually, I think we know what the numbers are. Mostly it was children were prey, but adults were also occasionally prey. And so being on the wrong end of a predator-prey situation was a very real problem for people. And as a result, they developed this capacity. So it's actually capacity. As they say in the technology industry, when they don't like something, the engineers will tell you, it's not a flaw, it's a feature. Okay, and this is exactly what this is. This is not a flaw you have. This is a feature. Now, the way we fix it is as follows. Very often people are told to sit down and relax and try to breathe deeply, et cetera, et cetera. This generally doesn't work. In my experience as a clinician, when I've worked with people with panic attacks, this has not typically been very effective. It's also not been very effective to do what we call cognitive therapy, to essentially tell them, well, what's the big deal? What's the big risk? Is there anything in the environment that's going to kill you? No, this doesn't seem to be very effective. What I have found to be very effective in my practice is to actually let the system do what it wants to do. What this thing wants to do is it wants to fundamentally contract the big muscles of the body. It does not want to sit. It will sit in a freeze as long as it needs to, until it has to break the freeze. When you are a prey, as soon as the freeze is broken, you are all in on a new strategy. The new strategy is you're going to run for your life for as long as you can and look for cover and hope to survive. So it's going to turn out that the best thing for panic attacks is to get up out of your chair and break the freeze and start to jog in place. And what people will find is after about 15 seconds or 20 seconds of jogging in place, they will be gasping for breath and very tired. Now, here's what's interesting about this. You haven't even come close to your capacity to run, okay? But the truth is that you're really not that afraid because there is no predator. So as a result, suddenly this becomes very inconvenient and the breathing gets hard and you're tired and your legs feel tired. And so then you feel like sitting down. And when you sit down, what you'll find is that your breathing will become deep. And as the breathing becomes deep, as you gasp for breath, what will happen is other areas of the mind that are monitoring this whole situation will say, looks like we escaped the predator, or we wouldn't have stopped running. You see what I'm saying? So as a result, the other areas of the mind basically make the inference that we must be safe. And as a result, they start dialing down the adrenaline, which is exactly the root of this entire thing. This is all being orchestrated by adrenaline. And so adrenaline is going to be responsible for all of these mechanisms that I've now shown, the sweating, the heart rate, the constriction of the breathing, the shutting down of the digestive system. All of these things are secondary to adrenaline. It's a very simple, well, it's obviously really complex, but I mean, it's biochemically a pretty simple process in order to cause this to happen, okay? If you drink too much caffeine, that's effectively the same thing. If you sit down and drink 6 cups of strong coffee, you will get effectively a panic attack. You will want to get up and move. You'll be feeling frozen. You won't know what's going on, etc. So that will mimic that situation for you. Now, a lot of times there's more adrenaline in you than you can burn off in 20 seconds. So about 15, 20 seconds or 30 seconds later, you'll still feel the edgy panic attack. You get up and jog again and do it again for 15, 20 seconds, and you'll get tired again, and then you sit down and you just go back and forth. And usually you can break a panic attack apart in 3 or 4 minutes, sometimes faster. Panic attacks, normally, if you don't do this, they can last for an hour. They can last for about the length of the time that in Africa, you needed to sit there and do nothing and watch that predator before that predator finally rolled around on the grass and then walked off back to the lion pride. See, so it's very possible for panic attacks to last for an hour, but if you short circuit them like this, they will pass very quickly. Now, here's another benefit to this, Gestapo, that once you have broken apart a panic attack this way, then the reason why people have habitual panic attacks is because they actually become conditioned or panicked about panic attacks themselves.
Right.
So they become, once you've ever had one, then the feeling of that adrenaline surge sends you into a panic, because effectively you're saying, oh no, we're having another one of those terrible things. And so it's useful, extremely useful clinically, to basically break a panic attack apart when you have one by this technique, because then you may not ever have another panic attack. Or you have one, but then when you break that one up, then your nervous system is no longer intimidated by adrenaline rises, and you never have a panic attack again. I've had many people that after they left my office with this explanation couldn't wait to have another panic attack, and then never had one, because they literally felt in command, and the system was no longer actually feeling that overwhelmed.
Out of control.
Yes, I had a little lady recently, when she heard this, it was like a miracle for her. And I got up and made her, she was actually starting to have one in the room, which was great. I said, yeah, start to run. And I said, you're running from the lion. And she was a silly sweetheart. And she said, "What, was it okay if I yell too?" I said, sure. So she's yelling and moving her arms and screaming like the lion's racing. And then she's laughing. And in seconds, this just huge relaxed relief comes over her, and we end the panic attack. Here's another little point to this. It isn't running per se, it's actually the contraction of muscles, technically.
Right.
It's very useful, because if you're let's suppose you're a famous great pianist, just suppose.
Just suppose. Yes.
Okay. Let's suppose that you're starting to have a panic attack in front of a big concert, and studios is got their cameras on. What you want to do is you can sit right in your chair like I'm doing now, and I'm contracting the big muscles in my leg. I cross my legs and then I push the ankles against each other, and I can exhaust those legs pretty quickly. And I can also have the arms right at my side, and I can push my elbows into my hips, and I can basically make muscles with my arms. And by doing that over and over again, you can do the same process, and it will cause me, like right now, I had to take a little bit of a deeper breath because I had those big muscles.
Right.
Take that deep breath, that starts to break down the adrenaline. So that's how we do it.
One thing I find very interesting, well, with me, but then talking to other people, I found that it wasn't just me, is that many times the panic attack started while I was sleeping. So I was woken up by the panic attack already.
Yes.
With a full panic attack. And I just wonder if it was a dream that was happening, or if it was that I was relaxed, and I don't know.
Sure, a lot of dreams are predator-prey situations. And so it's very, very likely that you're having something like that. Or you never know. For a lot of people, it's their mother-in-law's chasing them.
Yeah, and I don't have one, so that's
no. These predator-prey situations are common in dreams of one sort or another, and so it's not uncommon for people to wake up in a panic, and so this very same thing. If you get up, break the freeze, get up and move those big muscles around. Sometimes within seconds, you can be much more comfortable.
So why do you, is there an explanation why some people get these panic attacks and some don't?
The thing is that this sort of has to do with the propensity to rise adrenaline pretty high. And so there's going to be people that are going to be different as far as that goes. And it's also going to be the case that that if people are using things like caffeine that actually already up those things, or for example, if people are fatigued and under a lot of stress, their adrenaline is already high. So there's going to be of course there's a genetic underlying component that there's going to be a heritable component to this, as there usually is for most things. And then on top of that, there's going to be environmental circumstances that are going to add to this. So this is how it all works. But the biggest problem of all is once you've ever had one, Now the problem is that you may not ever have another one, but now you are set up, and it's very possible that it could start a little cyclic cascade. And so it's very useful to know how to break them apart, because once you start breaking them apart, then they start going away forever.
Right, right. I think I heard you talk once at True North about something similar, and you said that it's probably not a good idea to use medication. What can you talk about medication?
Yes. Yeah, the medication that you're going to typically get prescribed for this is going to be a benzodiazepine, like a Xanax or something like this. Or then sometimes doctors feel like they need to be really responsible and not give you a Xanax, so they'll put you on an antidepressant or a mood stabilizer or some such thing. These are terrible ideas. The benzodiazepines are the things that work. They work extremely well to bring down panic. The problem is that they are horrendously addictive, and so you are in way worse shape 2 weeks after starting to take Xanax than you were before you ever started. So essentially, I have met many psychiatrists who would love to give more Xanax because they're heroes. Because the person, as soon as they start taking it, they feel way better. But the problem is that they are setting them up for a wicked trap. That trap was not understood until relatively recently. So, a lot of people have been treated with these kinds of medications and shoved into a benzodiazepine trap. But this is happening less frequently now as the risks are understood. And for everyone listening, this is no solution. The solution is to break the freeze. Break the freeze. You feel frozen and you've got a very strong compulsion in your nervous system to not move. You feel helpless and absolutely like you cannot do anything. That's exactly how you're supposed to feel if you're looking at a predator 50 yards away that cannot see you, okay? You shouldn't move a muscle and you should feel incapacitated to move. That is how it is that system is going to extraordinarily discourage any movement, okay? But we can break the freeze. You can consciously get up and break the freeze, start moving and start jogging in place. Once you do that, you start breaking apart the panic attack, and you will essentially pull the weed of a system if you've been having them repeatedly. As you start to do this, you'll start to empower yourself in terms of your knowledge of your ability to diffuse these panic attacks, and then you won't have them. Okay, right. So that is actually the solution, and medication has no place in this problem.
So what would you say to people that have been driven into this trap and have been taking Xanax or some other thing for, I don't know, 5, 10 years?
I would say I would have them read 2 books, okay, if they're so inclined. Anatomy of an Epidemic by Robert Whitaker, and also then Psychiatric Drug Withdrawal by, I forgot his name, Peter Breggin, Dr. Peter Breggin. And so those, the notion is psychiatric medications, in my personal opinion, are a bad idea. and so particularly for panic disorder. And so the solution is to come off of these drugs, but you need to come off of them much more slowly than anybody realizes. This is the equivalent of, if you're on 4 cups of coffee, I would have you take 6 months to get off those 4 cups of coffee. You might think, well, why can't I just get off them in a couple of weeks? And the answer is because, coffee, you could do it in 2 weeks, but you can't do these things in 2 weeks. You have to take a long, slow time to get off of these things, or you will have a relapse relapses that will be quite disturbing.
Right.
Yes.
Right. Okay. Dr. Lisle, it's changing a little bit now to maybe if there is any connection with food. I think that a lot of people that switch from the standard American diet to a plant-based diet, they have anxiety. And about not, the food that they're going to eat and how much, and if they have to measure it, and if they're going to lose weight or not. So what would you say to anyone out there that is feeling anxiety over food? I mean, is it possible to get panic attacks because of food? Or
no, food isn't really related to panic disorder.
right.
As best that I know, it's a completely, these are apples and oranges kinds of things. But your broader discussion of people that are thinking about making these changes and they're worried and they're feeling anxiety and stress about whether or not they're going the right direction. My solution to all these things is to essentially look at this as an experiment. So I would say a more common source of stress in our arena with the people that we talk to, Gustavo, is people that are having anxiety and stress about giving up the last chunk of junk food that stands between them and some significant success. So they're staring down the barrel of giving up the cheese, or they're staring down the barrel of giving up the junk food of some kind, the ice cream. And they just look at this and they feel an agitation and a discomfort and even a depression about the idea of giving these things up. And they feel like they're about to enter a steel cage or a steel tube that they can't get out. They have to go down this path and that they can't go down the other path. And my solution to this is to not look at it this way, that you don't think that you are making such a big decision. You are making a small decision. It's a decision that you can revoke at any time. And the whole purpose of sticking your toe in the water and giving up something that we think may be problematic for you is to see whether or not the cost benefit is worth it. And so you can decide that in 6 weeks. You can decide that in a couple of months. That after you've dropped 12 or 15 pounds and you can wake up in the morning and your sinuses are clear instead of cloggy, and your skin feels better and you feel better and your digestion feels better and you feel more energetic and you're sleeping better, it's like, well, now maybe that's worth it. Okay. But you can decide that then. You don't have to take anybody's word for it now. And so this is, I see a lot of very smart adults sort of circling around this thing, like circling around it and circling around it, you know what I mean, with some kind of trepidation. Your word of honor is not on the line here. Okay. Right. This is not, you aren't being knighted and told that you have to defend the Holy Land. This is nothing that you have to do this way. This is just an opportunity to live your life differently and to see whether or not it seems like it's worth it. And if it's worth it, then you won't be in angst over it later. Okay. And that's right. How we approach this.
Very good. Very good. Well, this has been a very enlightening discussion. Thank you so much. I don't know if we have left out anything regarding the anxiety and panic attacks that you'd like to add.
Oh, I think I would add the following thing about anxiety and stress in general. And that is that probably the biggest thing that causes people to feel stress and anxiety is time pressure. And so the smartest thing that you can do is to essentially be cognizant of that and to give yourself more time to do things. In other words, the biggest thing that causes people the most stress and anxiety in their life is they schedule things too tight. They try to cram too much into a too small space, and then they wind up very stressed. And so one of the things that I do better these days than I used to do is I give myself more time when it comes to driving. So in the old days, if it took me 30 minutes to get across town to get to a dentist appointment, I'd leave with 32 minutes to spare, okay, and then be stressed the entire time. Whereas if I leave with 40 minutes to spare, so I've got 10 minutes extra, I literally feel rich. I feel relaxed, no problem. I'm waiting a long time at a red light. It doesn't even occur to me that it's an issue. And so using this, what I call a buffer zone approach to your time management is there's reasons why people don't do that. And that is that you've also got desires in there to essentially do everything that everybody else wants you to do in order to gain as much esteem as possible. So you've got an esteem-seeking mechanism in us that wants to be very productive and efficient and to put a lot into our days. Be at the PTA meeting, go hang out with your kids, take them to the park, talk to the church people, make sure you do the extra project for your job, cook something really great for your family. It's like you can see how easy it is for people to get overburdened. And then that overburden starts to put time pressure on everything. And that time pressure then leads to a low grade of anxiety that can be in the system and be uncomfortable. So those sorts of issues, which I explore in a video, it's on my website. It's called Success Forces. That issue of how it is to sort of manage our lives in a way that reduces that stress and anxiety. That's a useful set of techniques on there that are good for people to have if that's you.
Okay. Well, I was going to ask you earlier if you had any recommended reading, and you already gave us reading, or if you had a video, and you just mentioned a video.
Yes.
And your website is steamdynamics.org, right?
Steamdynamics.org. That's right.
Okay. We'll put it here on the screen. And the name of the video is?
Success Forces.
Okay. Very good. I want to encourage everybody to have a one-on-one session with you, because it's incredible what Dr. Lisle can do even in 30 minutes, and it's a very reasonable fee. And how do we get in contact if anybody wants to contact with you, Dr.?
Yeah, they could just email me at drdouglisle@yahoo.com, or they can also just go to my website at esteemdynamics.org, and the email thing is there, and you could also phone me or just sign up for a session if you want to.
All right. And I'm going to encourage people today to email questions as well to webinar@drmcdougall.com. That way, when we have our webinar next month in October, we can have maybe some questions regarding this issue.
That's great. Terrific.
Very good. And remind me, are you going to be at the Advanced Study Weekend, or you not?
Yes, I will. I don't know what I'm talking about yet. We'll figure it out in a couple of days.
Okay. Well, very good, because everybody remember that next week is the Advanced Study Weekend in Santa Rosa, California. And I think you can still sign up on the website, drmcdougall.com. But if it's sold out, you can actually sign up to watch it from your own home, and it's really cool. Of course, you cannot taste the wonderful food that they have like we can.
That's right.
But you can watch the whole thing, and of course, it's much less expensive. But still, it's a very reasonable fee, and it's you can do it from Dr. McDougall's website. So, Dr. Lisle, again, thank you so much for your time today.
My pleasure. Thanks for having me.
And I look forward to seeing you next week, and I look forward to seeing everybody there next week, and then we'll do another webinar at the beginning of October, hopefully.
Terrific. Looking forward to it.
Very good.
Okay. Bye.
Thank you. Bye-bye, everybody.